It's actually heart-pouring here. We've seen quite a number of, hospital or facilities, the staff who are here to participate in the inter-hospital, games taking place here in Durban. These are the private as well as public healthcare facilities here in the Durban district or Durban municipality. With me is one of the organizer of the games, Samgeli Siwe, who's going to tell us about the whole idea of coming up with these games. What are you hoping to achieve with these games, ma'am?
Okay, greeting. I'm Samgeli Siwe. With Splash Sports Tournament, we are hoping to bring two departments, private hospital and government hospital, together to be able to work together and be a one team. Actually, as we have seen this COVID-19, we have seen them working together so hard to save our life, to be with us in difficult times. Some in during this time they have lost their lives, and now we are hoping that we want to express how thankful we are to them, how we appreciate each and every work they've done to us. So with this sport tournament, this is us saying thank you very much for leaving your family and trying to save our lives. Thank you very much for risking your own life to be here in this situation today that we are in. So with the Splash Tournament, we would like for the department also, or department hospital, government hospital and the private hospital to form the bond, to have friendship, to communicate, because we have seen most of hospitals didn't have more facilities to use during this COVID-19, and then they had to find help from the other hospitalities. I think this putting them together will make even South Africa a better country. We have doctors and nurses who will work together in each and every situation, who are gonna be united. In whatever situation they come across, they know they got each other's back, and they know they have each other's help in every situation, and they'll know what they are here to save our country. And also this gonna motivate us as youth, that you know what, actually nursing and being a doctor is not a very bad thing. It doesn't mean that you won't even get a chance to have fun. As you can see, they are here having fun, enjoying the day. They don't care if it's raining or not. They're like, I'm here, we're gonna enjoy, we're gonna do everything as it is planned. So thank you.
Okay, let me move on to Dr. Stephen Simango, who's also a healthcare worker here based here in Durban. Doctor, you work in quite a stressful environment or conditions. How do these or such games help you to distress?
Thank you very much. We know that sports, physical activity has a lot of benefits. Those that do exercise a lot regularly end up with less disease problems, heart problems, cancer, and all the other diseases. The incidence is low. So we say that there's a lot of stress we've been taking during this period of COVID-19, especially during the past year. We are saying, as the levels are down and there's less work in terms of COVID-19, let's relax in preparation for what could possibly be the third wave.
Okay. We can see that a number of, we're told that a number of teams will be gathered here. Are we still expecting more, or is it just because of rain that is also stopped play here just now?
Yes, we had to delay the games a little bit because of the rain. The rain has affected us, but as sports people, come rain or fire, we go for it. That's what we are doing. We've got about 10 hospitals that are taking part in this. Only 2 couldn't make it, but in terms of both netball and soccer, but the boys are here in full force, unlike the girls maybe they're to stay home.
And is there a prize money and also some medals and trophies?
Oh, there are quite some good prices in terms of what we are offering for this tournament. We've got medals, we've got trophies, which will be won, 3 of them in total. That is the first, the number one is getting gold for both boys and girls, that is soccer and netball. 2 is also getting another trophy, and we've also got a kit that has been donated by the Department of Transport, Sports and Recreation to assist with that.
Okay, back to the health matters. We know that about 700 healthcare workers have succumbed to COVID-19 or related complications in the country. How does that make you feel, especially working in such conditions, knowing that every day you are more likely to see or to handle a positive COVID-19 patient?
It's a painful thing. The death of any person is at our hearts. We never like to lose a patient, no matter how sick, how old. We always aim to preserve life. And every time someone goes, it affects us. We've lost colleagues during this COVID-19 pandemic year. And from what we hear, as the third wave comes, more of us, it could be me next time, which is sad though, but it stresses us. Doctors, nurses, and all the people working in the hospital are stressed. Some end up with depression. Others, we hear, are getting to be suicidal.
And how does this impact your life personally now, especially at your family?
Every day you go home, you always think that I might be the one to kill my family. You always wonder, am I carrying the virus from work to home? We try other means to see how can we reduce the impact we have on our family. We take off our clothes when we leave work. I work in theater. We get home, we take off those clothes, put them in special baskets. We take a bath, wash, always observing the rules, sanitization and all those. But it really affects us as we go to our home, and we are always fearful that we might be taking it to our family.
I know also that we've covered a number of stories where the healthcare workers were also engaged in protests, calling for government to give them proper PPEs. Is that still the case in some healthcare sector generally?
Generally, the level of PPE has improved. Most of the hospitals are having enough PPE. The only problem that we have is that in the second wave, we're just overwhelmed with the numbers. The numbers were so much that we couldn't cope. The hospitals couldn't cope, the staff couldn't cope. And that was the main problem within the second wave. But most hospitals, unlike in the first instance, the level of PPE was reasonable and adequate. I would like to comment, from my knowledge, I would like to commend all those people that made it possible for us to go through this past second wave.
Okay, with the news that we might have a third wave, as the doctors or healthcare workers, are you ready to handle that?
Hey, you can never be ready. We do not know what is in stock. We might think we have been vaccinated and protected, but there's still the danger that the third wave could come with another variant for which everyone will be susceptible. So that's our fear as we go into this. Although for now we are saying, let's try this method to prevent people getting susceptible to the infection. Vaccination is our route. For those that are skeptical of vaccination, we know it's got side effects. We have heard, they say that 6 have had it in America and developed brain complications. Those are quite severe. 2 people, it's reported, have died. Let's also look at the other side. In Israel today, they are reporting that they've had no deaths from COVID. Israel is one of the countries that has conducted a successful vaccination campaign. So I'm hoping by the time it gets to us, the Lord will have given us a chance to get as much of our population vaccinated as possible.
How are we doing according to you and some of the healthcare workers that you are with here, especially knowing that India on a daily basis is recording about 100,000 infections?
Well, the good thing I can say about our healthcare workers that you see here, most of them have been vaccinated. We thank the population for allowing us to go first. And that's why we are able at least to play the games, although we're still observing the protocols necessary. So in India, they are now with their second phase. We don't know whether they'll get a third one or not, but us, we are waiting for our third and hope that with God's grace, it doesn't come. And it will all depend on you and I, what we do to save the population from a third wave. Let's keep it going, and if we do that, as a brother, you look after me, and I will look after you. That be the motto for everyone, to save the population.
And the level of vaccinations taking place around in the country, we know that government is almost done with vaccinating healthcare workers. Do you think the amount of speed is quite bad or good?
We would have wished a faster rate of vaccination. We know things have got to be explained to the people. I would have loved everyone to be vaccinated here, and that it's good that we're getting that grannies are starting to register on the government website. One thing that's difficult is that you need to go onto the internet, and for the rural population, that's a big challenge. And if we are to get a rollout, we need more people being on the computer. Kids, when you go home, ask Granny, use those phones to register Granny and all those above 60 for the vaccination. For this is the only way that will get us saved from COVID-19. Okay, thanks.
Yeah, well, thanks a lot. Dr. Stephen Simango is also one of the co-founders of this tournament taking place here in Durban, of 10 hospitals drawn from private as well as public hospitals here in Durban. We know that 1 in 7 cases of COVID-19 in South Africa, globally, are in healthcare sector. So these are the frontline workers who have come up here to participate in the games of soccer as well as netball. As I go out of the show, so that in Vusi Khmalo will show you some of the teams. This is Entabeni versus one of the hospitals, St. Augustine Hospital. As we know, the St. Augustine Hospital was also in the news late last year for having a number of positive cases as well as the deaths that took place there. So these are the workers who are actually coming from there, the nurses and the doctors who are participating in netball as well as soccer while here in Durban. Well, with that said, Blaine, it's back to you in the studio.